ഹായ് ഫ്രണ്ട്സ്, എല്ലാവർക്കും അറിയാം ഡിസംബർ 18-നാണ് നമ്മുടെ DME എക്സാമിൻ്റെ ഡേറ്റ് വന്നിരിക്കുന്നത്. ഇതിലേക്ക് നമുക്ക് പഠിക്കാനായിട്ട് വളരെ കുറച്ച് സമയമേ നമ്മുടെ മുൻപിലുള്ളൂ. 3 മാസം എന്ന് പറയുന്നത് നമുക്ക് നമ്മുടെ സിസ്റ്റംസ് മുഴുവൻ എടുത്തു നോക്കുകയാണെങ്കിൽ അത് പഠിച്ച് തീരാനായിട്ട് വളരെ കുറച്ച് സമയം തന്നെയാണുള്ളൂ. അത് പഠിച്ച് റിവിഷൻ ചെയ്യാനുള്ള സമയം എന്ന് പറയുന്നത് 3 മാസം കൊണ്ട് നമുക്ക് വളരെ കുറവാണ്. അതേസമയം പഠിക്കാൻ വേണ്ടി മാത്രം ഇരിക്കുന്ന ആൾക്കാരാണെങ്കിൽ അവരെ സംബന്ധിച്ച് ഈ സമയം ധാരാളം മതി. പക്ഷേ വീട്ടിലിരിക്കുന്ന വീട്ടമ്മമാർ, അതുപോലെ തന്നെ ഡ്യൂട്ടിക്ക് പോകുന്ന നമ്മുടെ കൂട്ടുകാരൊക്കെ ഈ സമയം വെച്ച് പഠിച്ചെത്തുക എന്ന് പറയുന്നത് കുറച്ച് പ്രയാസകരമായ ഒരു കാര്യം തന്നെയാണ്. അപ്പോൾ അങ്ങനെയുള്ള കൂട്ടുകാർക്ക് വേണ്ടിയിട്ട് കേട്ട് പഠിക്കാൻ എളുപ്പത്തിലേക്ക് DHSൻ്റെ മെയിൻ ലിസ്റ്റിൽ വരാനായിട്ട് എന്നെ സഹായിച്ച ഞാൻ പ്രിപ്പയർ ചെയ്ത ചോദ്യോത്തരങ്ങളാണ് ഈ വീഡിയോയിലൂടെ ഷെയർ ചെയ്യാനായിട്ട് ഞാൻ ആഗ്രഹിക്കുന്നത്. ഇതിൽ വളരെ സിംപ്ലസ്റ്റ് ആയിട്ടുള്ള ക്വസ്റ്റ്യൻസ് മുതൽ വളരെ ടഫസ്റ്റ് ആയിട്ടുള്ള ക്വസ്റ്റ്യൻസ് വരെയുണ്ട്. എല്ലാ പാറ്റേണും ചെയ്ത് പഠിച്ചാൽ മാത്രമേ നമുക്ക് ഏത് രീതിയിൽ എക്സാം വന്നാലും അത് നല്ല രീതിയിലായിട്ട് അറ്റൻഡ് ചെയ്യാനായിട്ട് സാധിക്കുകയുള്ളൂ. സിസ്റ്റമാറ്റിക് ആയിട്ട് പഠിക്കുകയാണെങ്കിൽ നമുക്ക് വിജയം സുനിശ്ചിതമാണ്. ഓരോ സിസ്റ്റം വൈസ് ആണ് ഇവിടെ ക്വസ്റ്റ്യൻസും ആൻസേഴ്സും ഷെയർ ചെയ്യാനായിട്ട് ഞാൻ ആഗ്രഹിക്കുന്നത്. ആദ്യമേ തന്നെ ഫണ്ടമെൻ്റൽസ് ഓഫ് നഴ്സിംഗിൻ്റെ ക്വസ്റ്റ്യൻസ് ആണ് ഷെയർ ചെയ്യുന്നത്. നമുക്കും സമയക്കുറവുള്ളതിനാൽ ഡീറ്റെയിൽ ആയിട്ട് ക്വസ്റ്റ്യൻ ഡിസ്കഷൻ ചെയ്യുകയില്ല. ക്വസ്റ്റ്യൻസ് പ്ലസ് ആൻസേഴ്സ് ആ ഒരു രീതിയിലാണ് ഇവിടെ ഞാൻ ഷെയർ ചെയ്യുന്നത്. ഫണ്ടമെൻ്റൽസ് ഓഫ് നഴ്സിംഗിൻ്റെ ക്വസ്റ്റ്യൻസ് ആണ് ആദ്യത്തെ വീഡിയോയിലൂടെ ഷെയർ ചെയ്യുന്നത്. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ ഈസ്: skin suture of scalp and face are left in place for 2 to 5 days. The name of enema used for making diagnosis is barium enema. Founder of modern nursing is Florence Nightingale. Fowler's position is maintained to relieve dyspnea. The action of glycerin is hygroscopic. The position for operation on the pelvic organ, that is Trendelenburg position. Emollient enema is retained enema. Who discovered RH factor? Landsteiner and Weiner. Expulsion of the waste from the body is elimination. Temperature of water for sponge bath is 110 to 115 degree Fahrenheit. Preservative used for collecting 24 hours urine specimen is boric acid. Inflammation of the stomach is called gastritis. Major cation of extracellular fluid is sodium. The art of feeling with hand is known as palpation. The excretory function of the liver is tested by BSP excretion test. Dash bed is used for the patient with rheumatism. Answer is blanket bed. Deficiency of sodium in the blood is termed as hyponatremia. Gradual filling and periodic emptying of the bladder mechanically is known as tidal irrigation. Pediculi found on the head is known as pediculus capitis. A wound with uneven edge is known as lacerated wound. Pea soup stools are typical of typhoid. The sharp instruments are sterilized by autoclave. Complete cessation of secretion of urine is known as suppression. ICN adopted the Code of Ethics in 1973. Dash is used to reduce the development of pressure sore. Answer is water mattress. Act of taking notice of something, which is known as observation. And encolostomy is single barreled. Temperature of water for steam inhalation is 120 degree to 160 degree Fahrenheit. In hyperpyrexia, the temperature is more than 105 degree Fahrenheit. PRN means when required. Infection of mouth can lead to inflammation of dash gland, parotid gland. A normal inhabit of mouth cavity is Bacillus acidophilus. Abnormal increase in the volume of urine is known as polyuria. The temperature of water for cold sponging is 65 degree to 90 degree Fahrenheit. Drugs which prevent the growth of fungi is known as antimycotic. Blood in vomiting is known as hematemesis. Florence Nightingale was born on 1820. One of the suprapubic catheters is mushroom catheter. Drugs that inhibit cough reflex is known as antitussive. Temperature of water for steam inhalation is 120 degree to 160 degree Fahrenheit. Administration of drugs is the form of powder is insufflation. Condition in which the urine cannot be expelled from the bladder is retention of urine. Cardiac position is a comfortable position to relieve cardiac asthma. Tympanitis is flatulence. Medicine given by mouth is called ingestion. First aid for foreign body stuck in the middle of the cornea is to close and part the eye. Hypodermal injection is also termed as subcutaneous injection. Peculiar susceptibility of an individual to some drug is known as idiosyncrasy. The length of the rectal catheter to be inserted into the rectum for evacuate enema is 8 to 10 cm. Most important person in the hospital is patient. Which blood group is known as universal donor, that is O. Drugs that stimulate the menstrual discharge is emnagogues. Universal recipient is AB. For taking rectal temperature, which position is used? Left lateral. Force exerted by the blood against the walls of the blood vessel is known as blood pressure. Listening to the sounds of the body by stethoscope is known as auscultation. The ratio of cardiac compression to ventilation when there is 2 rescuers is 5:1. Immediate disinfection of all contaminated article during the course of the disease is known as concurrent disinfection. Black stool is termed as melena. Presence of blood in the sputum is known as hemoptysis. Brown crust formed on the teeth is called sods. Primary effect of cold application is vasoconstriction. In diabetes mellitus, the specific gravity of urine is high. Specific gravity of urine is 1.010 to 1.025. Term used for freedom from infection is asepsis. The sharp instruments are sterilized by autoclave. For removing blood stains from linens, soak immediately in cold water. The temperature of low pyrexia is 99 degree to 100 degree Fahrenheit. Normal breathing is known as eupnea. Steam in autoclave for effective sterilization is 15 lbs per inch square. Pus formation in the sockets of teeth is known as periodontal disease. Oral temperature cannot be taken from a patient having cough. Enteroclysis is colonic irrigation. A woolen blanket is bad conductor of heat. Normal tidal volume is 500 ml. The method of applying medication to the skin is known as injunctions. An agent used to prevent the progress of inflammation is antiphlogistic. Oral medicine cannot be given to a patient having vomiting. Puncture of the wall of the thorax to allow aspiration of the pleural fluid is known as thoracentesis. Inflammation of the tongue is known as glossitis. Cold should not be applied when there is edema. 1 gram of fat gives 9 calories of heat. 1 gram of protein gives 4 calories of heat. Secondary effect of cold application is vasodilatation. Water content in urine is 96%. Pulse deficit is difference between radial and apical pulse. Drugs which produce copious watery stools are known as hydragogue. The size of the endotracheal tube for newborn infants is 4 mm to 5 mm. Drugs which constrict the pupil of the eye are myotic. Presence of blood in sputum is hemoptysis. Strength of the Dettol solution used for disinfecting the thermometer is 1:40. An ideal room temperature is 68 to 72 degree Fahrenheit. Drugs which dilate the pupil of the eye is pediatrics. Expulsion of stomach contents via the esophagus and mouth is known as vomiting. The cardiopulmonary resuscitation must be initiated within 3 to 4 minutes in order to prevent permanent brain damage. Body temperature falls below 95 degree Fahrenheit is known as hypothermia. Enema used to check the diarrhea, which is known as emollient enema. Measures taken to prevent disease, that is known as prophylaxis. Normal PCO2 is 35 to 45 millimeter of Hg. Amputation bed is also known as divided bed. Forecast of the course of duration of the disease is prognosis. Strength of potassium permanganate for mouthwash is 1:5,000. Normal serum potassium level is 3.5 to 5.5. In diabetes mellitus, specific gravity of urine is high. Cracking or ulceration of the lips and angles of the mouth is known as sordis, which is known as chelosis. Milky white urine is chyluria. Failure of kidney to secrete urine is known as suppression. 1 gram of fat gives 9 calories of heat. Formula to convert Fahrenheit scale to Celsius scale is C is equal to F minus 32 into 5 by 9. Chemical regulation of body temperature by the production of heat is called thermogenesis. Caloric requirement of the infant is 110 calories per kg of body weight. When the pulse is full and rapid in the rate is described as bounding fever. Specific gravity of urine is 1.016 to 1.025. Example of emollient is liquid paraffin. Skin traction used to reduce fracture of the femur in children less than 6 years is Bryan's traction. The name of the enema given to expel the worms from the intestine is known as antihelminthic enema. To collect specimen for culture, sterile bottle is used. The difference between axillary and rectal temperature is 2 degrees Celsius. Calcified, hard and tenacious material over the teeth is known as calculus. Halitosis is bad breath. Non-inflammatory desquamation of the scalp with itching is known as dandruff. When ice bag is applied to fever patient, the heat of the patient's body is transmitted by conduction. Normal pH of the blood is 7.35 to 7.45. Hemorrhage occurs within 36 hours after injury is known as reactionary hemorrhage. Method of organizing and delivering nursing care is known as nursing process. Method of giving large volume solutions subcutaneously at a slow rate. It is known as hypodermoclysis. Drugs that produce sleep, which is known as hypnotics. Stomatitis is the inflammation of mucous membrane of mouth. The color of stool when there is obstruction to the flow of bile is clay colored. Name of the surgery for the removal of organ or diseased part to relieve symptoms is known as curative surgery. To prevent food drop, foot rest is used. Abnormalities of gait can be detected by equilibrium test. When pulse rate is less than 60 beats per minute, which is known as bradycardia. Feeding given with an orogastric tube that is passed through the mouth and esophagus into the stomach is called esophageal fading. An artificial method of giving fluids and nutrients through the tube passed into the stomach is known as gastric gavage. Cloudy appearance of urine is due to the presence of amorphous phosphate. Extreme form of habituation is known as addiction. Difficulty in swallowing termed as dysphagia. Physical regulation of the body temperature by loss of heat is known as thermolysis. Milk is the basis of the full fluid diet. Putting a drug liquid form into body cavity is known as instillation. The period when the body temperature had reached its maximum is known as fastigium. Best method for sterilizing gloves is autoclaving. Loss of hair is called alopecia. This test gives information about the function of vestibular portion of the 8th cranial nerve, which is known as caloric test. Labored breathing is dyspnea. Give an example of a hygroscopic substance. Purgative enema. Hemorrhage occurring within 36 hours after injury is known as reactionary hemorrhage. The most reachable site for taking temperature is mouth. Normal pressure of CSF is 80 to 180 mm of H2O. Huge ugly turnover like overgrowth of smear is known as keloid. Hypodermal injection is also termed as subcutaneous. Other name of residual fluid diet is full fluid diet. In adults, site of lumbar puncture is done between second and third lumbar vertebrae. Lack of oxygen in the tissue is called hypoxia. Turbidity of urine indicates presence of pus. In a low tracheostomy, the incision is made at the level of third and fourth ring of trachea. Deficiency of oxygen in the blood is hypoxemia. Drugs sprayed through the skin without a needle is called hypospray. Euthanasia means mercy killing. For treatment of worms, the enema used is antihelminthic enema. The concentration of sodium chloride in our blood per 100 ml is 0.9%. Type of fever having highest temperature in the morning and lowest recorded in the evening is inverse fever.